So good afternoon. Can you hear me? Okay. So let's start then. Today our lecture will be dedicated to development of urinary and genital organs and anatomy of kidney and urinary tract. So as always, I told you, you shouldn't write down your names in the chat. I will see them clearly in the statistics. So please write in the chat just if you have any questions. So before we start describing the anatomy part, we have first to refresh some terms in our memory. So we said at our practical classes that both urinary and reproductive systems, they belong to urogenital apparatus. We didn't study, actually we studied, yes, locomotor apparatus before, and all the others were systems. And when we studied systems, we said that system of organs, it is a group of organs that is united by common function. So all the organs of digestive system, they perform function of digestion. All the organs of respiratory system serve for respiration. They serve for either passage of air or gas exchange, yes? And here we deal with another term, it is apparatus of organs. It is a group of organs that is united by common origin. So organs of urogenital apparatus, they have the same origin, and some of the organs are at the same time organs of both urinary and reproductive system. So we'll talk about it later. Now we need to prove that indeed organs of urogenital apparatus have common origin. Again, we see this diagram, and I don't know why it is so complicated, but senior students cannot memorize it. So in my opinion, it's very easy. Yes, that multi-layered embryo consists of 3 layers. The outermost, it is ectoderm, and it gives origin to the coverings, to the skin, and also to the nervous system, to neural tube. And then there is endoderm that is not present here, and middle layer, it is mesoderm, and mesoderm is divided into several parts. So when we studied digestive and respiratory system, we said that endothelium of this digestive and respiratory tract organs is lined by endoderm, is formed by endoderm, and all the other layers, they are formed by lateral plate mesoderm. Now we are interested in intermediate mesoderm. Intermediate is located between paraxial, that is closer to the vertebral column, to the axis, yes, and lateral plate mesoderm. So this intermediate mesoderm gives origin to both urinary and genital organs. So the first structure that is formed, it is nephrogenic cord. And nephrogenic cord extends from the cervical region to the sacral region of the embryo. So it is located like the most dorsally is neural tube located, then notochord, yes, and so nephrogenic cord, here it is also located in front of the neural tube. In kidney development, 3 stages are distinguished, and all of these stages, they pass during embryogenesis, during intrauterine development. So the first stage, it is pronephros or primary kidney, and then mesonephros or interim kidney, and metanephros or permanent kidney. Here we can see it. So these stages substitute each other. So the first one, it is pronephros formed, and pronephros is located in the cervical region, yes? Then mesonephros formed, that is located in the thoracic region after the pronephros degenerates. And metanephros is, or permanent kidney, it is firstly developed in sacral region. We will discuss it later. And by the moment of birth, it relocates to its normal position, to the lumbar region, yes, to the level of upper lumbar vertebrae. So first, let's start with pronephros or primary kidney. Pronephros is formed by 7 to 10 solid cell groups which join pronephric duct or primary excretory duct. And this pronephros is located at the level of the 5th or 7th cervical vertebrae. Pronephros exists during the 4th week of embryonic development, and it doesn't function, so it doesn't produce urine, and it's rudimentary. And with the time after the 4th week of embryonic development, it degenerates. After it degenerates, mesonephros is formed at the level of upper thoracic, from the upper thoracic up to the upper lumbar vertebrae. So pronephric duct, this primary excretory duct, it grows caudally and opens into the cloaca. So cloaca, you remember, yes, you studied it at school. It is a common place where urinary and digestive and even reproductive tract opens during embryogenesis. In some animals, it exists even after the birth. So this animals, they have cloaca instead of rectum and urethra and so on, yes. So close to the pronephric duct, about 40 mesonephric tubules are developed. And this pronephric duct, after it grows caudally, it becomes mesonephric duct. So these mesonephric tubules are developed and they open into mesonephric duct. And this mesonephros functions since the 4th till the 9th week of embryonic development. And during this time, it produces urine. The structure of mesonephros is very close to the structure of morphofunctional unit of kidney. So we can see there is aorta, yes, the main vessel that brings arterial blood, and some arteries which arise from aorta. They at the lateral end, are divided, and they form glomerulus. And this Bowman's capsule surrounds this glomerulus, and Bowman's capsule continues to mesonephric tubule. And so they are about 40 from every side, yes, and all of them open into mesonephric duct. And so here at the renal corpuscle that is formed by glomerulus and Bowman's capsule, filtration takes place, so production of urine starts. But as we have said, mesonephros also degenerates. So these mesonephric tubules, they degenerate, but duct stays. And this duct, according to the name of the scientist who discovered it, is known as Wolffian duct. And after the 9th week of embryonic development, close to mesonephric duct, paramesonephric duct is formed, or Mullerian duct. So final permanent kidney is formed in the sacral, at the sacral level, in the sacral region. So mesonephric duct and paramesonephric duct, they do not participate in formation of permanent kidney, but they give origin to genital organs. Now we will see it. So Wolffian duct or mesonephric duct stays in males, and Mullerian duct degenerates. So most of male genital organs originate from Wolffian duct. So it is ductus deferens and epididymis, appendix testis, and rete testis. In females, Wolffian duct degenerates, and only some vestigial organs that are appendages of the ovary, which are epiophoran and periophoran, only they are formed from Wolffian duct, so epiophoran and periophoran. In females, it's vice versa. So everything that is pink, it is Wolffian duct, yes? These are derivatives of Wolffian duct. Everything that is blue, these are derivatives of Mullerian duct. So in males, Mullerian duct degenerates, and only appendix epididymis, also vestigial organ, is formed from it. In females, vice versa, Mullerian duct forms most of genital organs. So they are uterine tubes, uterus, and vagina. But we continue with from third stage of kidney development. So metanephros, or permanent kidney, begins to function since the end of the 9th week. And it consists of two portions, excretory portion and collecting portion. So how are they formed? Collecting portion, it is an ureteric bud or metanephric diverticulum, which is projected from the caudal part of mesonephric duct. So cranial part of mesonephric duct participates in formation of genital organs, yes, but caudal part, from the caudal part, ureteric bud outgrows, and it gets surrounded by excretory portion that is a metanephrogenic blastema that is derived from caudal part of nephrogenic cord, from the caudal part of nephrogenic cord. So finally, this metanephrogenic blastema becomes parenchyma of kidney that consists of cortex and medulla, yes, and this ureteric bud forms pelvic ileal system of kidney, so minor and major calyces and renal pelvis, and also ureter. That's how it is formed. So as we said, metanephric kidney is initially sacral, yes, because it is developed from caudal part of mesonephric duct. But with the time, ureteric outgrowth lengthens and it becomes positioned more and more cranially. So finally, it reaches a lumbar region level of upper lumbar vertebrae. So some of the groups, maybe all the groups, yes, have already begun to study male reproductive system. And here the condition is opposite, yes. Testes, they first start to develop in thoracic region, or at the level of lower thoracic and upper lumbar vertebrae. And by the moment of birth, they should descend into scrotum. For urinary system, it's opposite, yes. Kidney, they first get formed in the pelvic cavity, and with the time they ascend. This fact makes kidneys very vulnerable to depression, so sometimes they can get depressed. It is a pathology that is known as nephroptosis. Nephra, it is Greek name of kidney. Ptosis means depression, yes. So in some cases, kidneys can descend, and it is a pathology. So yes, now let's say a few words about physiology. So actually, why is this urinary system so important? So our body, 70% of our body, it is water, yes, it is liquid. So some organs, they contain larger amount of liquid, for example, lymph 94%, yes, and joints 83%, lungs 80%. Some tissues, they contain less amount of liquid, like bones, only 22%, skin 64%. But in average, it is a very large amount. We are 70% water. And it is not a constant water, yes? Every time it changes, yes, every minute. So every day we intake and eliminate about 2.5 liters of fluid. And so just imagine, what exactly do we intake? So certainly the largest part of liquid we intake with beverages. It's 1.5 liters. 1.5 liters. Then 750 milliliters we intake with food, because food is not always solid. It can be rather liquid, like soup, but even if we eat something solid, anyway liquid is present in it. And also there is endogenous water, which you will discuss when you study biochemistry, like metabolism of nutrients, especially metabolism of lipids. It causes formation of endogenous water, and it is about 250 milliliters per day. And the same amount of liquid we should remove from our body, and 100 millimeters is daily evacuated with feces, and 200 milliliters it is sweat. Yes, no, this loss of liquid with sweat, it depends on the weather. Certainly, if it is hot today, then you will lose more liquid with sweat. If it is not, if it is cold, then less. It also depends on physical load. Yes, if you are physically active, then you will lose much liquid with sweat. Then 700 milliliters, these are insensible losses via skin and lungs. So with breathing, during exhalation, we lose much liquid, yes? But the largest part, it is about 1.5 up to 2 liters per day. This is the liquid which we evacuate in a form of urine. And this production of urine, it is absolutely a function of kidneys. So just imagine, whatever we intake, tea, coffee, cola, soup, all of these liquids finally get transformed into this liquid with a very constant composition, with a, yes, quite constant composition. So, but it is due to this function, it's not the only, it's not just production of and excretion of urine. It is a very complicated process. And due to it, urinary system performs some other functions as well. Like, first of all, it is excretion, yes, and then by means of this excretion, it is also regulation of blood volume and pressure, and regulation of concentration of solutes in the blood, yes, and regulation of extracellular fluid pH, regulation of red blood cell synthesis, because we'll talk about it later. There is such a part in the parenchyma of the kidney that is located between nephrons. Yes, it is juxtaglomerular apparatus. And there are some substances are excreted which regulate synthesis of red blood cells. And one more, it is regulation of vitamin D synthesis. So there are very many functions. That's why pathology of urinary system not only causes problems with urine formation and excretion, but also with blood pressure, with pH in the blood, and so on. Yes. So structures of urinary system are the following. They are kidneys, and then ureters, and both of them are paired organs, then urinary bladder, that is unpaired, yes, and urethra. So there are 4 organs which belong to urinary system. At the today lecture, and also together with these organs, we will also study adrenal gland. Here we can see that it is located at the upper pole of the kidneys. It is a paired organ. Adrenal gland is not an organ of urinary system, but due to anatomic proximity, we study it together with urinary system just because of the lack of time, just because we have no special topic to study endocrine glands. Okay, so let's start with kidney. As always, yes, you know that plan of internal organ description includes Latin name and Greek name, whenever it's possible, yes? So for kidney, Latin name is ren and Greek name is nephros. So for example, inflammation of tissue of kidney, it is nephritis, and operation of removal of kidney, it is nephrectomy, yes, so in Greek it is nephros. First, we have to know topography, as always, yes, and topography of kidneys is different, yes, because right kidney is located a bit lower than the left one. Why is it so? Because in the right hypochondric region, as we know, there is a liver, and it occupies a very large position. When we studied the lungs, we said the same, that inferior boundary of the right lung is located upper because it is inferiorly pushed by the liver, yes. And now we say the same about the kidneys. So right kidney is located lower because it is superiorly pushed by the liver, yes. So liver is a very big organ. So superior pole of the left kidney is located at the middle of the 11th thoracic vertebra, when superior pole of the right kidney is located at the lower edge of the 11th thoracic vertebra. Inferior pole of the left kidney is located at the upper edge of the third lumbar vertebra or at the lower edge of the second lumbar vertebra. It's actually the same, yes? And the inferior pole of the right kidney is located at the middle of the third lumbar vertebra. If you open the other textbook, you will find that left kidney is located between TH12 and L2, and right kidney is located between L1 and L3. Okay, yes, it is also acceptable. We can use this scheletotopy. When we study scheletotopy of the kidney, we also should know about the relation between them and the 12th rib. So 12th rib, here we can see it, this is the 12th rib, crosses the left kidney in the middle. And right kidney is crossed in the boundary between upper and middle 1/3. So this is also very important, especially when we perform a surgery on the kidneys to perform a suitable surgical approach. When we discussed digestive organs, yes, we said that their relation to the peritoneum is different, and in case when organs are located intraperitoneally, they are fixed to the posterior abdominal wall by mesentery or mesocolon, yes? There were also special ligaments, like for the liver, for the stomach, different ligaments, which provided fixation of these organs. Kidneys, as well as ureter, they are retroperitoneal organs, so they are covered by peritoneum from anterior side only, yes, but they also need a fixation. And to prevent depression of the kidney, there is a fixational apparatus of kidney which you have to know very well. So the first component, the first point of the fixational apparatus of kidney, it is muscular seat. Muscular seat. So muscular seat of kidney is formed which type of peritoneum? So we know that when peritoneum covers internal organs, it is visceral peritoneum. So certainly visceral. Yes, it is located retroperitoneally. Kidneys are located retroperitoneally as well as ureters. So muscular seat of kidney is formed by 4 muscles, and you have to know them. First of all, laterally, this is transverse abdominis muscle, yes. And then superiorly, it is lumbar part of diaphragm. And inferiorly, there are 2 muscles, which are quadratus lumborum muscle that belongs to posterior muscles of the abdomen, yes, and also psoas major muscles. So these 4 muscles create like a place for kidney location. This is muscular seat of kidney. The second point of fixational apparatus of kidney is its coverings. So there are 3 coverings of the kidney, and the innermost covering is a fibrous capsule or capsula fibrosa. We can see easily them in our preparations, in our specimen, yes. So it is formed by connective tissue, and it adjoins its parenchyma, kidney parenchyma. So it covers the kidney from all the sides. The middle layer is fat capsule or adipose capsule, capsula adiposa. So it covers not only kidney itself, but also it surrounds adrenal gland, and it does not cover it only from the surface, but it can also enter renal hilum, renal sinus. Yes, so this place is known as renal sinus, and it is better developed on the posterior surface of kidney and forms paranephric fat body, corpus adiposum pararenale. So this adipose capsule is especially important for the formation, for the fixation of the kidney, and it is easily to prove when a patient loses weight suddenly, very fast. In this case, kidneys can descend also. It's because this paranephric fat body decreased its size, and now kidney became like movable. Yes. Okay, in the outermost covering, it is renal fascia. Renal fascia has anterior and posterior layers, and they have different course. Yes, so anterior layer of the renal fascia, it starts from lateral margin of the kidney. Yes, it covers its anterior surface, and so from the medial margin of the kidney, it continues to the renal vessels. So it covers abdominal aorta and inferior vena cava. Yes, and it continues to the anterior surface of the other kidney, and laterally it joins posterior layer. Posterior layer of renal fascia starts also from lateral margin, and it covers posterior surface of the kidney, and at the lumbar vertebrae, it is attached to lateral margins of the bodies of lumbar vertebrae, so it does not continue here in front of the vertebrae, but it continues laterally from the lumbar vertebrae and again covers posterior surface of the other kidney, and laterally it joins anterior layer. It joins, so these two layers, they join laterally, and they also join superiorly, but not right above the superior pole of testis. They also surround adrenal gland, and so superiorly they join together. So then this renal fascia looks like a bag, like a pocket, yes, that is open inferiorly. So this anterior and posterior layers, they join laterally and superiorly, but inferiorly they do not join, and inferiorly they continue following separately from each other, because between them ureters pass to reach urinary bladder. So this is another fact that contributes to a possible descent of the kidney in case of a pathology. So the third component of fixational apparatus of kidney, it is renal pedicle. Renal pedicle includes all the structures which enter and leave through the renal hilum. And renal hilum, like in the liver, yes, we have already seen it. It is like a place on the medial margin of the kidney through which vessels, nerves, and also ureter enter and leave. Okay, so it includes renal artery and renal vein, yes, and also ureter, and also nerves and vessels. Why do these structures contribute to the fixation of kidney? Because tissues in our body, they can stretch, yes, but this elasticity of tissues is not endless, yes. So that's why these tissues, like even in case of a descent of the kidney can descend only up to the length of renal artery, so not endlessly, because renal artery starts from the abdominal aorta and renal vein starts from the inferior vena cava. So that's why these structures also participate in the fixation of the kidney. And the fourth component of fixation apparatus of kidney, it is intra-abdominal pressure. The higher this pressure is, the more immobile kidneys are. Also, in patients with a decreasing of intra-abdominal pressure, for example, after the pathology that was accompanied by increasing of intra-abdominal pressure. Yes, after this, if after this pathology pressure got decreased, it also can contribute to the descent of the kidney. It's not even compulsory pathology. For example, pregnancy, yes, uterus was very big, it compressed all the tissues in the abdominal cavity and also kidney. After the delivery, kidneys also can descend. About the fascia, anterior layer of this fascia, it covers abdominal aorta and inferior vena cava, yes, from anterior side. But in the gaps between abdominal aorta and inferior vena cava, yes, it attaches vertebral column partially. And posterior layer, it adjoins lateral margin of the bodies of the vertebrae, so it does not cover anterior surface of the vertebral bodies. So just it ends here, and then it continues from the other side. like it's like separated in the middle. Yes. Okay, so about external structure. External structure, it's very simple, and as it is paired organ, at your practical classes you will have to distinguish if this kidney is right or left. So two surfaces are distinguished in the kidney: anterior surface that is convex and posterior surface that is flattened. Yes, and there are two margins, medial margin or medial border that is concave and that has renal hilum, and lateral border, it is convex and it is just convex. And there are two poles, yes, superior extremity and inferior extremity. And superior extremity is more rounded and it contains usually adrenal gland on itself, yes. And inferior extremity, it is sharpened and so it doesn't contain anything, yes. So yes, it's actually usually very easily to distinguish right and left kidney. We also have to know the arrangement of structures in the renal hilum. So ureter occupies the most posterior position, the most posterior and inferior position in the renal hilum. The most anterior, it is renal vein usually, then the middle position is occupied by renal artery, and sorry, it's not like that. Yes, it is like that. Yes, right. This is like that. It is anterior aspect, yes. So renal vein occupies the most anterior position, then renal artery is in the middle, and the most posterior, this is for the ureters. What does this diagram try to show you? Yes, that distance between superior poles and between inferior poles is different. Like kidneys are located at an angle in relation to each other, and so longitudinal axis of the kidney does not correspond to longitudinal axis of the whole patient, or no, of the whole body. So here there are 8 centimeters between two superior poles, and between two inferior poles there are 11 centimeters. 11 centimeters. Okay, so in the internal structure of the kidney, there are okay, first it is parenchymus organ, yes, and in the parenchyma of the kidney that is located at the periphery, there are two parts, that is cortex, external part, yes, and then in the center there is a medulla. And centrally, even more medially from the parenchyma, there is renal pelvis. Actually, it is a collecting system of kidney that includes several structures. We will talk about them later. So to understand what exactly is located in cortex and medulla, we have to say a few words first about morphofunctional unit of kidney. So morphofunctional unit of kidney, it is nephron. And so certainly you remember that a morphofunctional unit of any organ or tissue, it is the smallest part of the organ that can perform all of its functions, yes? And so parts of the nephron are the following. This is renal corpuscle first, or Malpighian corpuscle. Here we can see it. It consists of Bowman's capsule from outside and glomerulus from the inside. And then this renal corpuscle continues to the proximal convoluted tubule, PCT, and the proximal convoluted tubule continues to the Henle's loop, then distal convoluted tubule, and distal convoluted tubule opens, as many other distal convoluted tubules, to the collecting duct. So each kidney contains over 1 million nephrons. So there are totally 2 million nephrons. For a patient, for a person to function well, 600,000 nephrons are quite enough. Yes, 600,000 nephrons. It is quite enough. So renal corpuscle that is formed by Bowman's capsule and glomerulus. It is responsible for the first part of urine, for the first stage of urine formation, that is filtration. We'll talk about it a little bit later. And then all of these tubules, they are responsible for reabsorption and secretion for the second and third stage of urine formation. And so here you can see that the most typical nephrons, which are juxtamedullary nephrons, they have their their renal corpuscle as well as proximal and distal convoluted tubules in the cortex, yes? And then Henle's loops and distal parts of collecting ducts, they have in the medulla, So this parenchyma of kidney, okay, first let's start with the cortex. In the cortex, we can see that substance is not homogeneous, yes? So it consists of alternating darker and lighter lines. So darker line, it is known as convoluted part, and lighter line is known as radiate part. It has different color because of different structures. Yes, different structures are present in it. Here we have to know that cortical cortex is divided into numerous cortical lobules. There are about 600 cortical lobules in every kidney. So cortical lobules is formed by radiate part that is surrounded by convoluted parts. Yes, so convoluted part includes renal corpuscle, PCT and DCT, so it is darker because these structures, they contain blood in itself, yes? And so radiate part is formed by collection ducts and limbs of Henle's loop. The whole parenchyma can be divided into renal lobes. So here, first of all, in the medulla, we can say that also substance is not homogeneous, and even this difference in the color and in the structure is even better pronounced than in the cortex. So here in the medulla, we can see such triangular structures, which are known as renal pyramid, and they are separated from each other by means of renal colons. Okay, and so here in the renal colons, there are interlobar arteries and veins. And so in the renal pyramids, there are some parts of the nephron. So renal lobe, it is a part of kidney parenchyma that is formed by renal pyramids with adjacent renal cortex surrounded by renal colons. That is also, you have to know, what is renal lobe. And so here in renal pyramid, here you can see it, renal lobe. So here in the renal pyramid, yes, there are Henle's loops and collection ducts, and interlobar arteries and veins are located in renal colons. So that's why they have different colors, yes, these structures. Okay, so how is urine formed? There are 3 stages of urine formation, and the first one is filtration. So what you have to understand that formation of urine is formed from the blood. So filtration occurs in Malpighian corpuscle. Malpighian corpuscle consists of glomerulus. Glomerulus, it is a network of capillaries, yes, and Bowman's capsule. So efferent arterial has larger diameter than efferent arterial, and this it creates filtration pressure. I don't know how to answer this question. If we are talking about the lectures, then it is, I think, the 4th for you. If we are talking about practical classes, then you have already had about 8 or 9. Yes. Okay. So efferent arterial brings blood, And this efferent arteriole is divided into branches, into many branches, which form glomerulus. And at the same time, we see, yes, the diameters of efferent and efferent arterioles, they are not equal. Yes, efferent is smaller. That's why a larger amount of blood can enter and less amount of blood can leave. That's why filtration pressure is formed. So excessive amount of blood should go somewhere, and it goes to the Bowman's capsule, yes? But to enter Bowman's capsule, it should pass through filtration membrane, through the filtration membrane. That is formed by one layer of endotheliocytes of the capillaries, yes, in the glomerulus, and also visceral layer of Bowman's capsule. Visceral layer of Bowman's capsule. So Bowman's capsule looks like a cup. Yes, looks like a cup. So it has parietal layer, and visceral layer, that is internal. And internal layer is formed by special cells which are known as podocytes. Podocytes are the epithelial cells which make up visceral layer of glomerular capsule. And so why is this filtration possible? Yes, here we can see filtration membrane. Components of filtration membrane, as I have already told you, it is endotheliocytes of capillaries, then podocytes of visceral layer of Bowman's capsule, and common basement membrane. Okay, and so there's a podocytes. Poda means leg, yes, site means cell. And so there are, like in amoeba, there are like this like outgrowths, yes, like processes, and between these processes there are slits, yes, filtration slits, spaces between food processes covered by a very thin slit diaphragm. So between them substances can pass, but not all of them can pass. We know that blood consists of plasma and blood cells, yes? So these blood cells cannot pass because they are very big. And also large proteins cannot pass through this membrane, but all the other substances pass, and they form primary urine. Now we will try to watch.
The filtration membrane blocks blood cells and large proteins, but allows water and small solutes to pass.
So here you can see it, yes? How it passes. Yes, how the substances pass. That is the first stage of urine formation. It is filtration, and result of filtration process is the formation of initial or primary urine, or also its other name, glomerular ultrafiltrate. And it is produced in the amount 170-180 liters per day. So its composition is blood plasma without large proteins. So we understand that our body contains not more than 5 liters of blood. And certainly we do not have 170 liters of liquid. So that's why we cannot excrete initial urine. That's why after the filtration, the other stages of urine formation follow, which are reabsorption and secretion. So this initial urine contains waste products which need to be evacuated, yes, but also other substances the body needs. These are essential ions, glucose, amino acids, and smaller proteins. And so all of the substances, they are reabsorbed through the tube wall into the adjacent capillaries. So here we have also to mention that kidney is an unique organ because it is the only organ in which after the capillaries, again, arterioles are formed. So usually we know that artery is divided into small arteries, which are arterioles, yes? Arterioles are again divided into capillaries, then capillaries become larger and then form venules, yes, and then veins and so on. Here there is an exception that is known as miraculous network of kidney, rete mirabili, because from the capillaries again arterioles are formed, and these arterioles are again divided into the capillaries, and they surround all of these excretory tubules of the nephron. And into this excretory tubules, into this capillaries, reabsorption goes back. So all the useful substances, they are reabsorbed, and so after that capillaries finally form venules. That's how it works. But not only reabsorption takes place here. Okay, now we'll try to watch a video about reabsorption first.
Nutrients pass through the renal tubule back into the capillaries. Here, the body reabsorbs what it needs and creates urine.
So that's how it happens, yes? But after that, also filtration occurs. So some substances which are, what did I say? Secretion, yes? Also secretion occurs. Some substances which are absolutely not required for our
waste ions and hydrogen ions pass from capillaries into the renal tubule. This creates urine, which passes out of the kidney into the ureter and down to the bladder.
Yes, so some waste substances such as urea, uric acid, hydrogen ions, yes, they get secreted, so they are again excreted to the urine, and so after the reabsorption and secretion, finally secondary urine is formed, and its amount, it is produced in the amount of 1.5 to 2 liters per day. And so now finally we reached composition of the urine. Mainly urine consists of water. So 95% of the urine is water, but also 2% it is urea, 2.8% dissolved salts and other ions, and 0.2% this is creatinine, ammonia, and uric acid. So that is composition of urine. And so this uric acid, yes, gives the urine this yellow color. And so after urine is formed, after it is excreted to the collecting ducts, so collecting ducts move towards the apex of the pyramid, and at the apex of the pyramid there are papillae. So very many collecting ducts join and they open at the papillae, and urine goes to renal collecting system, or its other name is pelvic-calyceal system of kidney. Pelvi because it consists of renal pelvis, and calyceal because it consists of calyces, minor and major. So first urine is excreted to minor calyx. One papilla opens into one minor calyx, and in each kidney there are from 10 to 12 minor papillae. Here, all of these are minor papillae. Minor calyces, what am I saying? Minor calyces. Then minor calyces, 2 or 3 minor calyces join each other and they form major calyces. In each kidney there are from 3 to 4 major calyces. And then major calyces join and form renal pelvis, and from renal pelvis urine goes to the ureter. Okay. Yes, we forgot to say about juxtaglomerular apparatus. Yes, so juxtaglomerular apparatus, it is a special endocrine part of the kidney that is located between efferent and efferent arteriole. Between efferent and efferent arterioles, there is first of all macula densa that perceives lower level of natrium chloride in distal convoluted tubules and stimulates secretion of renin by juxtaglomerular cells. And juxtaglomerular cells are located also here, close to efferent arteriole. So renin is a special substance, a special hormone that is produced by kidneys, and together with other substances such as angiotensin and aldosterone, they form like renin, angiotensin, aldosterone system that participates in regulation of blood pressure. No, just for you, it's enough to understand that renin participates in regulation of blood pressure, and it is produced by juxtaglomerular apparatus of kidney. That is endocrine function of the kidney. So after urine is produced and it is excreted to the renal pelvis, it continues its movement to the ureter. So ureter, here we can see it. It is a paired organ of urinary system, and its only function is transport of urine from the kidney to the urinary bladder. So it is also located retroperitoneally, and it's very long. Yes, so it starts from the renal hilum and it ends in the cervix of urinary, in the neck of urinary bladder. And so it starts at the level of first or second lumbar vertebra. So for the left kidney, we can say it is first lumbar vertebra. For the right, it is second lumbar vertebra, and it reaches pelvic floor. Yes. Okay. So it has three parts. Three parts are distinguished in it. The longest one, it is abdominal part, that is from the renal pelvis up to the terminal line. That is a boundary between abdominal and pelvic cavity. So please revise how it is formed. Yes. Then second part, it is pelvic part that starts from the terminal line up to the entrance to the wall of urinary bladder. And then intraparietal or intramural part that passes through the wall of urinary bladder. And so diameter of ureter is not equal at all the levels. There are some narrower places which are constrictions. The first constriction is located at the very beginning at the uretero-pelvic junction. Here we can see it. Then the second constriction is located at the terminal line. And the third constriction is located in the bladder wall, in the wall of urinary bladder. So in the wall of urinary bladder, ureter doesn't have a straight course. Yes, it moves obliquely. That's why intramural part has a definite length. And there it forms a constriction. When just urine passes through the ureters, it doesn't matter. Like, constrictions do not play any significant role. But when kidney stones are formed and ends on the pelvic floor, like if we are talking about skeletotopy, we can say at the level of the, let it be fifth, at the level of the apex of sacrum, let's say so. And so, but it becomes very important, these constrictions, when it comes to the kidney stones, yes? So kidney stones, when they start the movement downward to the urinary bladder, they are solid, yes? And probably they are small enough to pass through wide places of the ureter. But through the narrow regions, they cannot pass, and they can stuck there. And it is known as ureteric obstruction or ureteric occlusion, and it's actually very painful for the patient. And we have to know the location of these constrictions of the ureter to suggest a possible places of these obstructions. Yes? Okay. So internal structure of ureter. As there is mucous membrane, as always, yes, that is covered by multi-layered transitional epithelium. So transitional types of epithelial tissues you had to study in histology, yes, so I hope you know what does it mean, transitional epithelium. And it has mucous glands, this epithelium. So muscular membrane is two-layered in the upper part, so there is external circular layer and the internal one is longitudinal, and in the lower part there is the third layer, the outermost longitudinal layer. And externally, ureter is covered by adventitia, so from lateral sides and from posterior side, yes, it is covered by adventitia, and from anterior surface it is covered by serosa, because it is just like kidney, it is located retroperitoneally. So urinary bladder is the other organ of urinary system. Vesica urinaria, it is in Latin, and in Greek it is cystos. Yes, so inflammation of urinary bladder, it is cystitis. Here we can see it. This is urinary bladder. So urinary bladder has different topography, different syntopy in males and females. We have already discussed it when we studied structure of peritoneum. We said that behind the urinary bladder in males there is rectum, and peritoneum forms rectovesical pouch in pelvic cavity of males, yes. And for the females, behind the urinary bladder there is uterus, and that's why in the pelvic cavity, peritoneum forms two pouches in females, yes, vesicouterine and rectouterine pouches, so two pouches. And certainly also we can say that behind the urinary bladder in males there are some male reproductive organs such as seminal vesicles, and below there is prostate gland. So we will talk about it at the next lecture that will be dedicated to the male, not only male, to the reproductive organs. So it is a hollow organ, hollow muscular organ that serves for storage of urine and excretion of urine. It's like a balloon, yes, where urine can be stored. That's why we urinate not every 5 minutes, but there are very big gaps. There are very big gaps, gaps between urinations. That's why we can leave and we shouldn't stay the whole day in the toilet. Yes, that is the main function of the urinary bladder. Okay, so external structure is very simple. So it is located, empty urinary bladder is completely located in the pelvic cavity, in the true pelvis. And full urinary bladder can reach even level of the umbilicus. So it has apex, then it has body, and it has fundus, and the very low part there is a cervix, yes, that continues to the urethra. Internally, we can see that in the lumen of urinary bladder, there are three openings. One of them, it is opening of the urethra. So it's where urine goes after urinary bladder is full, yes. And two more, these are openings of ureter. Here we can see them. Internal structure is very similar with the internal structure of the ureter. So again, mucosa is covered by transitional epithelium, and there are very many folds here because urinary bladder is very stretchable. Yes, actually, urinary bladder can contain up to 1.5, maybe it's quite much, but up to 1 liter of urine. It can not easily, but contain. Yes. And yes, that's why some mucosa is very well developed because it contributes to formation of folds. Yes, there is the only place where there is no submucosa at all, and this place is known as vesical trigone or trigone. It is bounded, like its apex is formed by internal urethral opening, and its base is located between two ureteric orifices. So here at the neck of urinary bladder, vesical trigone is located. So outside of the submucosa, there is muscular layer, and in the muscles there are 3 layers of muscles. These are just like in ureter. There are 2 longitudinal, external and internal, and there is circular layer. And unlike muscular layer of the intestines, where these muscular fibers could contract separately from each other to provide peristalsis, yes, to provide movement of the chyme. Here in the urinary bladder, all the fibers contract together, and that's why they are united into a single muscle that is named detrusor urine muscle, musculus detrusor urina. And so the outermost layer, empty urinary bladder, is located retroperitoneally, like all the other organs of urinary system, but full urinary bladder is located mesoperitoneally. So it is covered by peritoneum from posterior side and also from 2 lateral sides. And only anterior surface of urinary bladder is never covered by peritoneum, and it adjoins posterior surface of pubic symphysis. So micturition or urination, it is a process of urine excretion. So normal capacity of urinary bladder, it is 5 to 700 milliliters, but I told you it can contain even 1 liter, or in some people even 1.5, but it is in like some cases where persons are forced not to excrete the urine. Yes, in normal cases, like when it reaches 500 milliliters, it's better to evacuate it. Yes. But first urges to urinate appear when bladder contains 200 milliliters of urine. So when there is not enough, like there is not so much urine in the urinary bladder, then the urine muscle is relaxed and urethral sphincters are contracted. We discussed it at the very first lesson in the semester, yes, that what did we discuss? That there are two sphincters in rectum, yes, and in urethra it is the same. There is internal and external. Internal urethral sphincter is involuntary, and external urethral sphincter is voluntary. So even when internal urethral sphincter gets relaxed, we still have a few minutes to reach toilet, yes, and only after that external urethral sphincter also gets relaxed. But after the detrusor contracts, when there is very large amount of urine, then internal urethral sphincter relaxes. That's how micturition occurs. And so after that, after the contraction of urinary bladder, urine goes to the female urethra, or not compulsory to female, but to the urethra. So first, here you can see female urethra, uretra feminina. So there are some sexual differences, gender differences between structure of male and female urethra, because in males, as we will say a bit later, urethra performs not only function of urinary system, but also reproductive. In females, urethra is just an organ of urinary system, and it is short and relatively broad, if to compare it with male urethra. So its length is 3 to 3.5 centimeters. And in the mucous membrane, there are longitudinal folds, and there are mucous glands, and there is also muscular membrane, and from outside it is covered by adventitia. Female urethra, as we will study it also in reproductive system, opens into the vestibule of vagina. So such anatomical peculiarities, I mean that fact that it is short, what is its name in Greek? I think it's just urethra. I didn't hear about the Greek name because inflammation of urethra is also urethritis. Yes, so that fact that it is short and broad, it makes urinary tract in females very vulnerable to different types of infections. So cystitis and even nephritis, they are much more common in females than in males, because in females urethra is short and broad, so different bacteria can easily pass through it. So male urethra, here we can see it, it is longer and narrower, and so several parts are distinguished, 3 parts are distinguished in it, yes. So there is prostatic part first, that pars prostatica, its length is about 2.5 to 3 centimeters, and it is pierces the prostate gland, yes, it passes through the prostate gland. Then the second part is membranous, pars membranacea, that passes through the perineal muscles, through the muscles of pelvic floor. And the last part is spongy, pars spongiosa, that passes through the spongious body of penis. So it is the longest part. So it is not only longer and narrower, it is also not straight. So there are 2 curves in male urethra. One of them is fixed. So if male urethra is S-shaped, yes, one of them is fixed, that passes through the perineum, yes, here, and this curve is directed, faces backward, yes, and the other one is mobile curve, that is between a bulb of penis and body of penis. Here we can correct it. For example, when we need to insert a catheter inside the urethra. And so due to the fact that male urethra serves not only for the excretion of urine, but also it acts as a genital organ. So it conveys the sperm, the semen, into the female reproductive tract. There are some additional communications of male urethra, such as, for example, into the prostatic part. Prostatic glands are opened, and ejaculatory duct also gets opened, and into the spongy part, bulbourethral glands or Cooper glands, and also urethral glands are opened. Okay, so these are some peculiarities of structure of male urethra. We will discuss it in detail, in some more details when we study male reproductive system at the next lecture. Yes, it's not the end, sorry. So yes, so male urethra is long, and also its diameter is not equal at all the levels. So there are some narrowed parts and some dilated parts. So this narrowed part, these are constrictions, and dilated parts, they are expansions or dilations. And so constrictions are located, there are three constrictions. The first is located at the internal urethral opening at the very beginning. The second one is located in a place where it passes through the membranous part, so through the perineum. And third constriction is located at the level of external urethral opening, at the glands of penis. And so three dilations, they are located in prostatic part of urethra, in the bulb region, and also in the navicular fossa of urethra. It is also important in the case of stones. For example, stones passed through the ureter and they reached urinary bladder, and then finally they need to be evacuated through the urethra, and also they can stuck in some of these places, so we have to be aware about them. Yes, and as I promised you, we also study adrenal glands together with urinary system, though they are not organs of urinary system, they belong to endocrine system. So adrenal gland or glandula suprarenalis. Suprarenalis that is located above the kidney. Yes, it is a paired organ that is located at the superior pole of each kidney, and it is triangular in shape, and in the parenchyma of the adrenal gland cortex, peripheral part that is cortex, and central part that is medulla are distinguished. So medulla produces stress hormones, epinephrine and norepinephrine. And the adrenal cortex is divided into three zones. So the innermost zone, it is zona reticularis, that produces sex hormones, so mainly androgens. That's why, both androgens and estrogens. That's why even in males there are some estrogens, and in females there are some androgens. Yes. Then in the middle zone, it is zona fasciculata, fasciculate zone, that produces glucocorticoids, cortisol, for example. These are hormones which are responsible. These are hormones of stress, and also they are responsible for the metabolism of carbohydrates. And the outermost zone, it is zona glomerulosa, glomerulus zone, that produces mineralocorticoids, aldosterone, which regulate blood pressure and also metabolism of salts. So that is, these are the functions and structure of adrenal gland. That is all I wanted to tell you for today. Do you have any questions? So no questions. Yes, actually, previous lecture I have already sent you, and yes, PDF of this lecture I will send to you as well. Так, that is all, yes? Okay, so see you next time. Goodbye.